Hello everyone, my name is Savita Maharjan. I'm a student of Toyohama Institute of Technology. I'm doing graduate diploma in infection risk management level 7. Today I'm going to present my e-pamphlet of fundamental of infection risk management, and my presentation topic is methicillin resistant staphylococcus, also known as MRSA. MRSA is caused by the one of the strain of Staphylococcus aureus, which is resistant to the methicillin antibiotics and also many more antibiotics. Staphylococcus aureus is a gram-negative bacteria present on the surface of a skin as a normal flora of a human body. It causes disease when our body immune system became weak or we inject from the outer side. It is one of the most common hospital-acquired infection. And the improvement of antibiotic resistance bacteria like MRSA is due to many reasons like misuse of antibiotics, overdose of antibiotics, and also not completing the dose of antibiotics. Today there are many kinds of antibiotic resistance disease like MRSA, and people are investing lots of money in the research to get rid of such kind of disease like MRSA.
Go.
The mode of transmission of MRSA are different types of modes. It is transmitted by the direct contact direct contact with the infected people or colonized people, and it is also transmitted with the materials used by the infected patients like towel, clothes, or any objects used by the infected person. Uh, the skin scales of infected patients can be mixed in the air during the bed preparation in the hospitals, and which leads to contamination of nearby air. From the air also it can be transmitted to the different people, and it will affect especially the immunocompromised patients, and it can be spread through the surface like door handles, sinks, floors, cleaning equipments, as MRS bacteria can remain there for a long time. And when we toss such kind of door handle and the door handles, other equipments, that can transfer into our hands. From hands it can ingest or it can transfer inside the body and cause the disease.
Oh,
MRSA usually infect our skins and shows different signs and symptoms like swollen, redness, and painful to touch. And not only the skin, it also affect our different organs of our body as it goes to the bloodstream also, and infect different organs like lungs and cause the pneumonia also. The associated risk factor related to the MRSA are, according to the health service, people who contact with MRSA infected patients are mainly affected, and other associated factors are like immunocompromised patients, people who have weak immune systems in their body. They can get easily infected by MRSA as they don't have the immunological elements to fight against the disease. Even their normal flora can change into the disease and attack to the MRSA also. And another is dialysis patients and people with the insulin therapy. People who are in diabetic condition or having the long-term insulin, they also have the weak immune systems, which leads to the MRSA, because in diabetic patients, if they got the wound or cuts, it is difficult to heal that kind of wounds and cuts, which later on after some time it infected by the Staphylococcus and it changed into MRSA also. Others risk factors are newborn baby and elder peoples, because newborn peoples haven't developed the immune system completely. That's why they are affected mainly. And whereas elderly peoples have declined their immunological power, that cause the disease. And others are people who take antibiotics frequently. People who take antibiotic frequency also get the MRSA, because when people take normally many antibiotics, that antibiotics get used to the that antibiotics is get used to by the bacteria, and bacteria start to adapt the resistivity against that antibiotics. So people who normally use many antibiotics also get the disease. And who have cuts and burns. The people who have large cuts and greater degree of burns, that kind of wounds is difficult to heal, and their that kind of cuts and burns also destroy the normal flora, which protect our bacteria also, other bacteria to be colonized. So they get the colonized by the infected other infected or infectious organism like MRSA. Having another is having surgical site infection. The people when get the surgical site infection, they get colonized by the many kind of bacteria, and such kind of bacteria get resistant to the antibiotics. And one of the cause of having that MRSA in surgical site infection is antibiotic resistance, different antibiotic resistance.
Go.
To control and prevent MRSA, different organizations like Central for Disease Prevention and Control and WHO have established different guidelines for the prevention and controls, and which is adopted by different countries, which includes New Zealand also. And the guidelines mainly includes the patient's placement, hand hygiene, personal protective equipment (PPE), proper handling of patient's care equipment and materials, environment cleanliness, and public awareness. First of all, they have also established the surveillance of a disease and the disease condition related to MRSA also. And about the patient replacement, when people get the infected with MRSA, such kind of patients should be isolated from the other patient to protect other patient from the transmission of a disease. MRSA infected patient must be isolated from other patient. Patients who have chances of transmitting infection must be given priority, and the prevention caution must be taken to their excreta and any secretion, because other hospitalized patients are also have weak immune systems. That's why they can get easily transmitted from MRSA from the MRSA infected patient. So that such kinds of patients should be isolate from the other patient. And other is handling their excreta, because excreta like urine, stools, they are also infectious, because from there also that bacteria can be transferred to the air and other surface. So such kind of excreta should be disposed properly. And other is hand hygiene. One of the most preventive and the worldwide use guideline is hand hygiene, because from our hand is the main route that we get inject of bacteria inside our body. So hand hygiene should be implemented before and after examining the patients. It is necessary to hand wash and with antiseptic soap and water. We can use alcohol hand rub also, where we can get instant soap and water. Hand washing must be performed after handling infected specimens like body fluids and the blood. Uh, WHO have given the five steps or five five methods to do the hand when to do hand washing. Is first one is before touching patient. Second is before cleaning or aseptic procedure. After completing or doing any procedure, you have to wash hand. Or after body fluid exposure, when we get exposure to the body fluids, like especially in laboratory, when laboratory staff use the body fluids or get exposed to the body fluids of infection, they need to wash immediately their hand. After touching a patient while examining, if we touch the patient or we examining the patient, that time also we need to wash our hand. After touching our patient surrounding, because after surrounding like that bed, tables, that can also have the remain the bacteria, as MRSA bacteria can remain for a long time. So after touching the surface also we need to wash our hand. Other guidelines includes is personal protective equipment. Personal protective equipment includes the gloves, eye protection, masks, gowns, while dealing with the infected patients and their specimens. Another thing is proper handling of patient care equipment and materials. Uh, Contaminated materials have the potential to transfer infections, so that single-use materials like a needle, the catheters should be discharged properly. Whereas the reused materials like a blood pressure cuff, dialyzers should be decontaminated properly. Laundry of patients should be handled and processed carefully also. And environment cleanliness. As MRS bacteria can remain for a long time, it is necessary to clean the surrounding of clean means we have to disinfect the surrounding of a patient. Other is public awareness. We should educate people about the prevention and control measures of MRS.
Go.
Public awareness also include the knowledge about the infectious disease. So people who are from the non-medical background also can know the how to prevent or how to do self-protection from the infectious disease like MRSA. Uh, MRSA is nowadays being one of the biggest problem in the worldwide, because it is being resistant to the not only methicillin, other beta-lactamase bacteria antibiotics also being resistant to the MRSA. So many scientists are doing research to get rid of from this disease. Uh, it is necessary, it is a duty of every person like health worker and public people to do prevention method and to control the disease like MRSA, because MRSA is killing many people day by day. So it is better to do prevent. It's like it is also, we can say that an ounce of prevention is worth a pound of a cure. So it is necessary to do cure of a disease. Thank you.